Yes. I will call meetings called to order, and Commissioner Chung
Here.
and Commissioner Chow.
Yes.
I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. So, Commissioner Chung, would you like me to call the items?
Yes, please.
Sure. So we can move on to item 2, the minutes, and I have a quick comment from Commissioner Chow. Hold on, where is it? On item 4, which is, let me get the page number. On page 2, item 4, Commissioner Chow asked me to take out the phrase "to trifecta" in the sentence. I actually don't see it, Commissioner Chow.
It's actually in the title, and then to clarify the length of the contract.
Oh, yeah.
I apologize. So I will take that out in the minutes. And so when you all consider approval, know that that's the version that you'll be approving.
Well, is the length of the contract correct? I mean, going to 23 is not 7 months, right?
Well, that's the exact same thing that was on the agenda, Commissioner. I can go back and check that. But this was exactly how it was on the agenda. I don't change anything for the minutes.
No, that's why I'm not saying that it's an error. I just wanted to clarify. If it says 23, that's fine. Maybe you can just double check that to be sure.
I will go back and do that. So those are the two possible, one correction and one possible correction.
Right.
Yeah, it will either be 7 months or 1 year and 7 months.
Yeah, it's got to be
Depends
one
on
or the other.
Okay. So there's no public comment for this item, so it is up to you two. Besides those comments, anything else?
I would move to accept the minutes.
Okay, and I also want to thank Commissioner Chow for sitting in for me while I was away. So I second that motion.
Thank you. And with just two of you here, that is an action for approval, so thank you. We can move on to item 3, the monthly contracts report, and Mr. Goodwin will be presenting.
Hi, everyone. Good afternoon, commissioners. The first item you have is an amendment to the Harm Reduction Coalition contract for the Harm Reduction Training Institute, or HRTI, and the Drug Overdose Prevention and Education, or DOPE programs, for a total contract amount with contingency of $4,375,237, with a contract term being extended an additional 12 months for a total of a 5-year term from July 1, 2019 through June 30th, 2024. And for the annual amount of the contract for 22-23 being increased by an amount of $100,096. This contract is to continue the support of HRTI and DOPE individual and group trainings, as well as technical assistance provided by the Harm Reduction Coalition. The proposed amended agreement is authorized through a 21.5 sole source waiver. The department is requesting approval of a total contract amount of $4,375,237 due to the following: a one-time CDC funding in the amount of $3,000 for fiscal year 22-23, 4% cost of doing business in the amount of $14,610 for that same year. The third item is a 4% CODB in the amount of $5,152, and an increase of $200,000 to additional one-time Mayor's Office General Fund surplus for fiscal year 22-23. The initial amount was $400,000 for the DOPE SRO project. Current funding is now $600,000. And then that was offset by a decrease in the California Department of Public Health funding in the amount of $122,666 for that same fiscal year, 22-23. If commissioners have any questions, Nicole Trainer, the acting CHEP System of Care contract manager, is here to respond.
Questions, commissioners?
Yes, I'm trying to like do the maths for this one. And I don't, I think I must have missed something because like it says that increased by total amount, annual total amount is $100,096, but just the one-time mayor's office general fund is already $200,000. So how am I missing something? Oh, I see a decrease in California Department of Public Health. Okay,
Yeah. That offset it.
okay, I didn't see that earlier. Thanks.
I had the same thought when I read it, Commissioner.
Anything else?
Yeah.
No,
No
I,
other question.
I thought the explanation was very good, and also I appreciated that there is one page per contract, so it really makes it easy instead of beginning another contract in the middle of a page where it actually, I realize that my ad pages, but it really makes it easier. So I just wanted to know it. I appreciate the separation of the contracts. So thank you very much. I would move for a recommendation to the commission.
Oh, Commissioner Child, that's not going to be done until the other
That's right.
contract.
That's right. We're going to go through the whole thing for the contracts report.
Right.
Thank you.
But,
Sorry,
oh no,
I got carried away with the fact that I appreciated being able to see the separation of contracts.
and I'm thinking that's Mr. Goodwin's doing since he's somewhat new. So thank you, Dean, for the change in format.
My
Let's
pleasure.
move on to the Public Health Foundation contract, please.
Next up is an amendment for our contract with the San Francisco Public Health Foundation. In this contract, the San Francisco Public Health Foundation provides program administration and management services of community-based organizations, or CBOs. Specific subcontractor management services for CBOs in this agreement are in support of programs relating to COVID-19 community prevention, mitigation, and wellness programs, including focused outreach, mobile test site support, and community care for COVID-19 positive individuals, and to serve other vulnerable populations. This contract was previously approved at the June 7th, 2022 Health Commission. The total contract amount with contingency requested amount is $6,131,618, with a continued and unchanged term for July 1, 2022 through June 30th, 2023 for a total of 1 year. San Francisco Public Health Foundation will receive a 5.7% administrative fee and a total of $293,161 for this fiscal year. The balance of the funding going towards programmatic costs, including staff equipment and onboarding, as needed subcontractor agreements and community outreach and engagement activities. The increase will continue to support the COVID-19 modality. This amendment continues to be under the San Francisco Administrative Code, Chapter 21.42 authority. The department is requesting the approval of a contract amount with contingency in the amount of $6,131,618, or an increase of $4,724,659 due to the following changes, and this is all an increase from COVID-19 funds. If commissioners have any questions, Isela Ford, who serves as a COVID Community Response and Recovery Manager and Latino Community Focus Equity and Neighborhoods Deputy Director, as well as Aaron Yen, the Chief Equity Officer, are here to respond.
And I'm just going to throw out, thank you, Dean, that Commissioner Chow forwarded the question, which I forwarded to Aaron and Isela. I'll read it out loud. In the service description, it says program administrator for one CBO selected by RFP. Why only one CBO, and won't an RFP take some time to select? And since this is only a 12-month contract, how will that impact the process?
Yeah, I'll take it. Thank you, Mark, and thank you, Commission, for having me here. I think the contract that's being referred to is A1 on page 2, which is our accelerated vaccine equity funds. And that is not necessarily one CBO, but really two. So I think if you look at when you look at the service description in terms of number 1 and 2, there's two CBOs that will be selected. One is for focus primarily on PEH populations for COVID response, and the other CBOs to focus for youth and youth CBO to focus on COVID response. So it's really two. I think and I apologize, this is my first time here answering questions at the commission. So yeah, it's really two CBOs. It's just worded in service delivery in the second paragraph, 1 and 2. And that's to focus on population specific COVID response. If that makes sense. Happy to answer any other questions.
Well,
No, thank you. I appreciate that you've pointed out that there are really two. But it says that we're going to need an RFP. So unless you've done that ahead of time, our RFPs sort of take almost a year sometimes. And then if there are, I guess, why would we only look at one? It's how do we select if we don't use an RFP? Then how do you? Well, first of all, the RFP takes a long time if you really do a formal RFP, and this is a 1-year contract. The second question is why we only would think that one each or two CBOs out of 10 really require additional support, or is it that we didn't have enough money and everybody should have been supported?
Yeah, so there's kind of two parts. So there's the A1 and there's the A2. The A2, there's 10 funded CBOs that were carried over that were already doing COVID response. So there's that piece. There's 10 organizations that have already been selected through an RFA process. I believe a year and a half, 2 years ago, that are continuing to provide COVID response. That is part of this contract. The accelerated vaccine equity funds is newer. That RFP has already gone out. It's looking for a September start date. We do have CBOs that have already put in their proposal, and we do have good indications of which ones will be selected, and the start date will be sometime in September. So it's not just one. Looking at the question, I didn't, just to be honest, wasn't aware which kind of contract was it referring to. So there are 10 other CBOs that are participating in COVID response for specific priority neighborhoods.
All right, so this special program for one each in each of your two areas of emphasis, uh, uh, what distinguishes the fact that out of the 10, we're only selecting two, or are these two new ones in addition to the 10, which then would make some sense?
Yeah, essentially they could have been affiliated with some of the CBOs before. So this was old funding that was given to our vaccine branch to identify kind of where equity access was limited. So at the time, youth and PH populations were the two populations identified as having the least vaccinated demographics. So that's why there was a call out to work with specific CBOs that really hone in on those populations to support those focus efforts to kind of get those vaccination rates up. That's why. And the two would be um, one is new, but the other has been adjacent to the process of response.
Okay, no, that's fine. Thank you.
Any questions for you, Commissioner Chong?
No, not from me.
Great, thank you. Let's move on to and thanks, Aaron, and welcome to the Health Commission meetings. And let's move on to Helena Health for right.
Okay. Third item, next we have the approval of a contract amendment with Helena Health to increase total amount with contingency to reflect an amount of $9,697,459. The contract term will remain the same. The Health Commission previously approved this contract on May 4th, 2021. The contract provides program administration and support services to the Community Health Equity and Promotion section, or CHEP, in the following areas: continuum of HIV prevention, care, and treatment, CHEP, ending the HIV epidemic, ETHE 2010, Hep B free, and Hep C, and Hep C's, rather, sorry. Of the $2,062,641 annual funding, Helena Health will receive 12.1% administrative fee of $222,640. with the balance of the $1,840,001 going toward programmatic cost. The proposed amendment is authorized under RFQ 36/2017. Additional funding will continue to support prevention services for the CHEP program. The department is requesting the approval of a total amended contract amount of $9,697,459, or an increase of $762,782 in one-time CDC grant funds and COVID general fund dollars to be utilized in the 7 different program areas detailed in the Health Commission memo related to hepatitis B, Hep C, HIV, and STI prevention initiatives, as well as an increase of $28,041 to the 12% contingency amount. And if you have any questions, commissioners, again, we have Nicole Trainer, acting CHEP System of Care Contract Manager, is here for you.
Commissioner Shaw.
I was just going to appreciate that, even though it's a very small part of this contract, that HEPI-free has not been forgotten. And at least it does show that the department still remembers that they're part of this. And that has been something that many of us have been working on for many years. So it's probably not enough to continue their program, but it does acknowledge from the department that HEPI-free has a role in our strategies for the hepatitis viruses. So thank you.
So I think that concludes the contract report. So do we have a motion to?
Yes. Now I would move that we recommend the contracts report to the commission.
Okay, and I second. So the contract report will be added to the consent calendar for approval.
Thank you.
Thank you, Mr. Goodwin.
And we do have item 4, request for approval of a new contract with Omnicell Incorporated.
Yeah, we have approval of a new contract with Omnicell to buy previously leased pharmacy equipment, associated licenses, and support and professional services. Total contract amount of $3,334,120 for the term of June 30th, 2022 through June 30th, 2027 for 5 years. And we have David Smith here, who is the Chief Pharmacy Officer with the San Francisco DPH, to provide more program details and answer any questions commissioners may have.
Hello, commissioners. Can you hear me okay?
Yes.
Wonderful. So my name is David Smith. I'm the new Chief Pharmacy Officer here at DPH. And this contract that we are requesting approval for is with Omnicell for $3.34 million. Omnicell is a company that currently provides key automation devices such as dispensing cabinets, packagers, and carousels that significantly improve the efficiency and safety and oversight of the medication management, both at ZSFG Hospital and Laguna Hospital. Both locations right now currently have all of these cabinets and equipment in place and have had them for many years. And that lease that we were leasing them, and that lease was expiring. And so the purpose of this contract was essentially 2-part. One was a one-time buyout for all of that existing equipment that was already in place, rather than continuing to lease. And that was at a rate that was consistent with the current lease rate, or in some cases below, depending on how long they're there. And then probably more importantly, ensures that we have a maintenance service agreement in place. And that maintenance agreement was really one of the priorities to make sure we have that as soon as possible, given Laguna Honda's precarious position, to make sure that the support and service of these machines was not interrupted in any way. It essentially continues the previous level of service, which was more than adequate. They've done a great job making sure that the machines continue to operate and run efficiently, and that we can maintain all of our daily operations at both sites and address any issues that do come up in the meantime. My quick summary. I welcome any questions.
Right. My question, which I posed earlier, was that with the, I mean, it seemed to me that for a long time, Laguna has had issues of pharmacy, and when the Omnicell came, that was actually quite helpful. But as I look at the numbers here and compare to what we spend at General, I wonder if you professionally feel that it's enough support. I mean, the support that you're pointing out is really vital, is less than $50,000 in this contract. And considering that the recertification program really requires also that we shore up our pharmacy accuracy and all, would is that adequate, or are you all thinking that we pass this contract first, but we'll have another one evaluating the needs at Laguna?
Excellent question, Commissioner. The one clarification was the smaller amount of Laguna Honda actually reflects that when we actually bought out many of the machines that were at Laguna in a previous modification of the old contract. So we already owned many of the machines that were there. So this is actually buying out a much smaller proportion of the existing machines at Laguna, as opposed to ZSFG, where we were leasing all of the machines that were there. So this was really to make consistent that we owned all of the machines across both sites, so that it reflects more that contractual decision and one of the modifications rather than the overall amount of support for medication management at each of the sites. And you're already thinking one step ahead. This contract is actually, we prioritized it early, but we are also going to be bringing most likely very shortly another contract with Omnicell in front of the commission for approval for exactly what you were talking about, is furthering the replacement of all of these cabinets in the coming years as they near their end of life. So it gives us an opportunity to upgrade the existing equipment across the board and kind of further enhance everything that we can do with medication management. And so that will be kind of the next step. But we separated both of these contracts, the purchase from the new equipment, in order to expedite the maintenance contract portion to make sure we had that in place for while Laguna was undergoing recertification.
No, thank you for the explanation. I don't have any other questions. A very important service, and we need the equipment for it.
Yeah, but just out of curiosity, so about cost saving, how much does that save us
That's
for
a
the
great
next 5
question.
years?
It probably depends on how long we use these. Ideally, we want to replace them right as they're getting towards the end of their useful life, not extend it too much, because as you know, things tend to break. That's kind of like when you forget to take your car in and get the oil changed. At some point, the car is going to be worth more hassle than it's worth. But the nice thing is once we purchased it, and if for whatever reason things get delayed, we will not incur any additional costs, and that's kind of free money at that point. So that's really where the majority of potential cost savings can be found. But this is not an increase in any of the costs that we are already paying through the lease of the prior contract.
Thank you.
Absolutely.
And commissioners, there is one person on the phone, so I just want to check with them. Person on the line, if you'd like to make public comment on item 4, the request for a new contract with Omnicell, please press *3 so we can recognize you. *3. All right, I don't see any hands, commissioners, so you're welcome to make a motion.
I would move that we recommend this contract to the commission for approval.
Okay, and I'll second it.
Thank you.
And so we'll add this to the consent calendar for approval.
Yes.
So pretty painless process.
Thank you so much.
Thank you.
And we can move on to item 5, emerging issues. Anything? Okay, not hearing anything. We can move on to item 6, public comment. First on the line, this is a time to make comment about something that's not on the agenda, so a topic that's not on the agenda. Please press *3 if you'd like to make a comment. I don't see a hand. So commissioners, we are now at a consideration for adjournment.
I would move for adjournment.
And I will second.
Great, thank you so much.
So the meeting is adjourned, and I'll see